There is a $140 billion wave moving through medicine right now. It started in diabetes clinics. It has now reached cardiology, nephrology, hepatology, neurology, and weight loss centers worldwide. The drug at the center of it is semaglutide. In this video, I am going to break down exactly what is driving this market shift, what the clinical evidence actually shows, what the real risks are that most people are not talking about, and what it means for patients considering these medications. Stay with me. This is Dr. James Ries from 20 Mile Medical, a board-certified telemedicine practice focused on evidence-based men's health, metabolic medicine, and longevity protocols. My goal is to give you the same quality of information your doctor should be giving you. Not pharmaceutical marketing, not social media hype, just medicine. Let me start with the numbers, because they are extraordinary. Doctors prescribed GLP-1 medications to non-diabetic patients 700% more between 2019 and 2023. By 2023, semaglutide accounted for 60% of all obesity prescriptions in the United States. The projected market size is $140 billion. To put that in context, that is larger than the entire global vaccine market. This is not a niche drug category quietly gaining traction. This is one of the fastest commercial expansions in pharmaceutical history. Why is this happening? Because the mechanism of GLP-1 receptor agonism turns out to affect far more than blood sugar, and the clinical data keeps expanding. GLP-1 medications started as diabetes drugs. Here is where the evidence has taken them. Obesity, FDA approved. The SURMOUNT trials showed 15 to 22% body weight reduction, numbers not seen with any previous weight loss medication. Heart health study results are very good. This was a landmark finding that changed how cardiologists think about these drugs. Heart failure, specifically heart failure with preserved ejection fraction, an area with very limited treatment options. Early but compelling evidence here. Kidney study results are very clear. Liver disease affects millions of Americans with almost no approved treatments. GLP-1 agonists are showing real promise in reducing liver fat and inflammation. Brain disorders. Early research examining GLP-1 receptor agonism in Alzheimer's disease, Parkinson's disease, and addiction pathways. The mechanisms are biologically plausible. The trials are underway. GLP-1 drugs will shape medicine for the next decade. That is not hype. It is where both the clinical evidence and the market are pointing. Access is also shifting in ways that deserve scrutiny. Direct-to-consumer telehealth sites sell GLP-1 prescriptions online with minimal clinical evaluation. Some turn to compounded alternatives, and that is where serious risks begin. During drug shortages, some compounding pharmacies produce semaglutide with documented problems. But 508(b) certified outsourcing facilities operate under an entirely different regulatory framework, one that requires FDA inspection and pharmaceutical-grade manufacturing standards. At 20 Mile Medical, we work exclusively with FDA-inspected 508(b) certified facilities, verified through the TrueScripts Pharmacy Network. This is what responsible telemedicine looks like. The question is not whether these drugs work. They do. But breakthrough therapies require careful prescribing, not fast prescribing. Patients deserve real evaluation and follow-up care. GLP-1 drugs will shape medicine for the next decade. If you want to know more, 20 Mile Medical offers consultations. Subscribe and visit 20milemedical.com. I am Dr. James Ries. I'll see you in the next one. Disclaimer, this is educational only, not medical advice. Always consult a licensed provider.